Welcome to our seminar, which is designed solely for patients with macular degeneration. I think you're going to learn a great deal about this condition that is reaching epidemic proportions in this country. The Macular Degeneration Association, which I am proud to chair, wants to thank Regeneron and Novartis, who have sponsored our numerous patient education programs for more than a decade. And we're particularly excited about having Nodal Vision as our sponsor today. I'll tell you more about Nodal Vision and my experience with it at the end of the seminar, or the webinar. So anyway, the Macular Degeneration Association is keeping up its work in educating patients during this COVID period. We generally do live presentations at hotels around the country, and we hope someday to restart that again. So without further ado, I'd like to introduce you to Dr. Jeffrey Gerson from the Grid Eye Care Center, who is the optometric medical director for the Macular Degeneration Association. It's Dr. Gerson. I now turn the educational program over to you. Thank you.
Great. Thank you, Larry, and good morning to everyone logging in. Thank you very much for logging in for something that we think is a really important topic, and hopefully something that will really be of some real value. Hopefully everyone will take away something and learn something this morning from the talk. I just want to echo Larry's sentiment in thanking our sponsors and supporters, because without them, we wouldn't be able to bring programming and content like this to you. So the idea here is I'm going to talk for between 30 and 40 minutes, and we have the Q&A function within the platform. If you have questions, feel free to type them in at any time, and I'll try to be monitoring as we're going, as well as have a question and answer session when we're done. Because hopefully we can make this at least somewhat interactive, just like if it were live in a hotel, like Larry mentioned, we normally try to do. We want to try to mimic that as much as possible and give you the opportunity to interact, ask the questions that are on your mind, because if it's on your mind, it's probably on someone else's mind as well. So real quickly, I wanted to touch on just a quick note about COVID-19. I know it's something that we've all heard plenty about, we're sick of hearing about, but what I want all of you to realize is that macular degeneration really doesn't care about COVID-19 or any other pandemic or any other world event. Macular degeneration goes on. And it's really important to continue with your healthcare, and in particular, eye care needs, especially for those of you with macular degeneration, or those of you that are helping to care for somebody with macular degeneration. There's actually published data that shows that less people are being seen for dry macular degeneration right now, and macular degeneration in general, than have been historically. That means people are staying at home. That means that people aren't getting care when they need it, which unfortunately, and I'll touch on this in a little bit, ultimately leads to poorer outcomes. So really important to continue with your eye care and the rest of your health care. You should realize that eye exams are safe. I can tell you that I'm in the office virtually every day, and we're taking extraordinary precautions of everyone that comes into the office is wearing a mask, has their temperature checked, uses hand sanitizer. We're constantly sanitizing surfaces, rooms, all of our equipment. Everyone has to answer questionnaires. Eye care offices are a safe place. So I want to make sure that you realize that and that you continue with your ongoing care. So I want to start out with just some, I guess, kind of simple anatomy to kind of understand when we say macular degeneration, what's the macula? What does that mean? And so the macula, and I'll show this a couple different ways, but you see here, the macula is that a little bit darker spot kind of in the middle. And it's really the real important part of the back of our eye. That is, when we look at something, that's where we focus. We focus with our macula. And that's why it's so important, because if the macula isn't working well, then whatever we're looking at, we don't really see it very well. So how else can I explain that to you? So I like analogies. And the analogy that I'll use here for you for ocular anatomy, so what's in the eye, is that of a camera. And most of us on here, unlike maybe my teenage son, know what a camera is with film in it. It's something that's kind of gone by the wayside, right? But for us, we all know what cameras are with film. And I want you to think of that as far as the eye. And so, oops, sorry about that. So what we see is the different parts of the eye that you may have heard about. The eyelids are like the wiper on the bottom camera here. The conjunctiva, you might have heard of conjunctivitis. That's like the housing that kind of goes around the eye. The cornea is the front lens. The iris in your eye is like the diaphragm in a camera. The lens in your eye, if you have cataracts or have heard of cataracts, that's what the lens, that's the internal focusing mechanism. And your retina is like the film in a camera. And remember, if you got bad film in a camera, you're not going to get a good photo. So now let's break down the retina, because that's where we find the macula. So a couple different depictions here of the retina and of the macula. So again, the retina is the film in the camera. The macula is the center area, and the fovea is the very center of the very center. And then we have blood vessels, and you can see on these pictures here, those little squiggly lines, those are the blood vessels. The circle is the optic nerve. The squiggles are the blood vessels, and that area that's a little bit darker but still pretty uniform in color, that's the macula. And when we're talking about macular degeneration, that's the part of the eye that we're talking about being affected. So where is the macula? So when you look at something, you can see here on this middle kind of diagram, light goes into your eye and forms an image on the back of your eye, on the retina. And right where that light comes to a point, that's the macula. So that's kind of the pinpoint for where we have our detailed vision. Again, that's why it's so important. Now, how big is the macula? It's not much bigger than the head of a pin. So it's a very, very small area. And so it's really important that we monitor this very small area for our very fine, detailed pinpoint vision. So what is age-related macular degeneration? So AMD stands for age-related macular degeneration. So before I talk about the kind of medical or sciencey of what it is, I want you to realize that AMD is something that can be very scary, and that for many people, it is a source of anxiety and depression. That up to 40% of people with macular degeneration develop some sort of anxiety or depression because of their diagnosis or because of the potential for loss or change in vision. Macular degeneration can be a thief of vision. Now, I realize I used the word can, and I didn't say is, because not everybody that has macular degeneration has noticeable loss of vision. Macular degeneration can be detected, and it can be managed. There's no cure, but there are things we can do to help manage, to try to prevent loss of vision or loss of your function. And also, very importantly, it's a condition for which there is support for you, whether it's through groups like Macular Degeneration Association, whether it's your personal eye doctor, whether it's a therapist, a psychologist, whether it's friends that are going through the same thing, or whether it's local support groups. Macular degeneration is a condition for which not only there is support for you, but is a condition where you should seek support, because you're not alone. Macular degeneration affects literally millions and millions of Americans. So you may also hear it referred to as ARMD, age-related macular degeneration. It is the most common cause of legal blindness in seniors. I'm very careful to use the term legal blindness, because blindness is like if you close your eyes and turn off the lights and cover your eyes. That's blindness. Legal blindness it basically means when your eye doctor puts up the big E on a chart, that you can't see that with glasses or something to correct your vision. Now, does everyone with macular degeneration develop legal blindness? Absolutely not. Symptoms for macular degeneration can be anywhere from none to very mild to extensive. So there's a huge range of what may or may not happen for macular degeneration. Again, there are things we use as treatments for wet macular degeneration, although there is no cure. And we know that ARMD has the potential to impact the quality of your life. And that's really important to know, that that it can do that, and your eye care provider should realize that, and realize that it's not just a disease to take care of, but something that affects you as a person. So who gets macular degeneration? So number one, the most really two most important characteristics or risk factors are age, because it is an age-related disease, and family history. We know that macular degeneration runs in families, and about 70% of it is due to genetics. Women are more likely to get macular degeneration, and it is far more common amongst Caucasians. We also know there are some very modifiable risk factors, things that may pertain to you that you can do something about. Number one on that list is smoking. We assume that everybody knows that smoking is bad for you, but as it turns out, the majority of people with macular degeneration don't know and haven't been told that smoking is really bad when it comes to macular degeneration. Obesity, diet is really, really important when it comes to macular degeneration. We'll talk a little bit more about that. And then just controlling other general health concerns like cardiovascular disease, high blood pressure, and then overexposure to sunlight. It's another environmental factor that can potentially be causative of macular degeneration. So let me pose a somewhat rhetorical question. What do you know about macular degeneration? So by the way, I will say that we had a question come into the Q&A that says, so what do you do if your doctor tells you that they don't want to see you right now because you just have dry AMD and switching to another doctor isn't an option? So what I would tell you the most important thing in that situation, probably what that would be is number one, especially if you're taking a supplement or doing something like that to try to be preventative, to continue doing that, to monitor your vision. And if you have any changes in vision at all, to alert your doctor that you've had a change in vision, that's now an acute event that warrants an office visit. I understand telling people, you know, you're at a high, because most people with macular degeneration are in a high risk group just because of age. And so it makes sense to try to limit office visits if at all possible. However, if there's any change in vision, that's somebody that needs to be seen immediately. Ideally, if you have dry macular degeneration, depending on the stage, you'd be using something called 4C Home that helps monitor your vision for you. And we'll talk more about that. But it's a great question because it really shows the importance of home monitoring. So thank you for the question, and feel free for people to send in more. So what do you know about macular degeneration? You may ask, which is better, the dry kind or the wet kind? Or I have patients ask, do I have the good kind? And the reality is neither one is better, neither one is good. However, either way, what's important is to know that you have it and to do something about it that we'll talk about. Many of you know somebody that says that they're blind from macular degeneration. What I'll tell you is that nobody goes blind from macular degeneration. I mentioned that earlier. Maybe legal blindness, but nobody is blind because of macular degeneration. I don't want that to be a fear of yours. Now, you may know that somebody lost vision in your family, but not know why. And it may or may not be macular degeneration. There are many different eye diseases that cause, or potentially could cause, the loss of vision other than just macular degeneration. We can't assume just because someone's of the appropriate age that they necessarily have macular degeneration. So I want you to realize that. All right, so let's talk a little bit more about the macula. So the macula is really a unique area of the retina that gives us our best, most detailed vision for reading and driving. It allows us to see color, and it's very, very thin in the center and is affected by many different diseases, not just macular degeneration. There are many other things that can potentially affect this part of the eye. So with macular degeneration, it almost always starts out as the dry form. And we'll talk a little bit more about that. But generally, you may hear people talk about either having dry or wet macular degeneration. You can see on this picture here, there's a bunch of little, almost like little dots. And those little dots are little things called Drusen. And that's what we see in dry macular degeneration, early degenerative changes of that part of the eye of the macula. So these drusen are very characteristic of dry macular degeneration. And by the way, when someone's eye looks like this, it's not that same uniform coloration I showed you in the normal. They may still have very normal vision. They don't necessarily have this picture that you see down in the bottom where we're missing people's faces. That's a much more extreme version or result of macular degeneration that not everybody experiences. Dry AMD may progress to the wet kind. The wet kind is called that because it's growth of abnormal blood vessels that can bleed. And it's that bleeding that leads us to call it wet macular degeneration. And sometimes people have advanced, even dry macular degeneration. When they have more of these drusen, they have little changes to the pigment, or even some atrophy, some area of that macula that starts to really not function very well. And vision loss can occur when we develop this type of atrophy. And I'll show you some pictures of that. But I wanted to kind of explain to you some of the words you may hear from your eye doctor. So how common is macular degeneration? So I mentioned this earlier. It's a leading cause of legal blindness in the US in people over the age of 50. About 90% of the cases are dry, and only about 10% will ever progress to wet macular degeneration. Somewhere around 11 million Americans have AMD, and we think somewhere between 1 and 1.5 million Americans have wet macular degeneration. So 11 million Americans, that's a pretty big number. And somewhere around 250,000 are legally blind because of the disease. So if you want to put this in terms of COVID, because that's something that we hear about all the time right now. And so we hear about, I think we're somewhere between 3 and 4 million Americans now that have, or 4 million actually, million Americans that have been diagnosed with COVID, at least to this date. 2.5 times that many people in the US have macular degeneration. So just to put in perspective the actual numbers of how prevalent this is. So have you heard of glaucoma? Most of you probably have. AMD is approximately 3 times as common as glaucoma. So I just want you to realize that, again, just putting a face kind of on the disease, on how common it is. Most of you probably have some idea of what genetics is. AMD is driven by genetics. About 70% of what causes macular degeneration is genetics. Another question that just came in from Melanie is, do you think it's all environmental factors if there's only one person out of 5 siblings who has AMD and there's no other family history of it in the family? So the way I would answer that is sometimes family history is difficult to know, because sometimes people don't know if a family member actually had AMD or if it was something else. So family history is sometimes a little bit difficult. And no, I think it's still at least some genetics. So if genetics is 70%, think of that as a light switch. And genetics may be pushing the light switch part of the way up, but the lights haven't gone on yet. And so it takes something to push the light switch the rest of the way. So you have a genetic predisposition, but it's the smoking and your obesity or your diet that pushes it the rest of the way. So there's probably some similar genetics, obviously, among siblings, but different environmental factors. But that doesn't mean that it's all environmental factors. Okay, so what is the vision of a person with AMD? So the most important thing to tell you is that most of my patients with macular degeneration have normal vision. And if you wait until your vision is like this, what we see on the Mona Lisa, it's too late. You can't wait until you have a change in your vision to think about or do something about macular degeneration. It must be earlier than that. So people with AMD can be anywhere from 20/20 to really bad. You can have really good or really poor vision with dry AMD. The same can be said about wet macular degeneration. But what's really important is the best predictor of outcome if somebody actually needs treatment for wet macular degeneration is what's their vision when they're first diagnosed with the wet macular degeneration. Meaning, are they receiving proper care? Are they monitoring their vision? Are they seeing their doctor at the absolute earliest stage when there's a change? Really, really important. So here's a picture of somebody with dry macular degeneration. And what you see on here is we see these little dots. Those are the drusen. And so that's what I oftentimes see when I look into people's eyes and diagnose dry macular degeneration. Here are 2 more examples here. The drusen are a little bit bigger. So those little dots, they may be fainter, but they're a little bit bigger. They're not just pinpoints. And then here in this one, we see somebody that has a condition that's called geographic atrophy, where there's a large area of the macula that is atrophied. So that's a big area in the center of their vision with which they just don't see. And that's what creates the picture that some of you may have heard of or may experience, where when you look at somebody's face, you look right at their nose, but you don't see their nose. It's gone. And that's because their nose is falling right in there, and it's falling on an area of the retina or the macula that just doesn't work anymore. A technology that you may have heard your doctor talk about is something called OCT. And the way I want you to think about this is a very fine-tuned very elegant ultrasound. And you remember those dots I was showing you on those pictures? That's how we see them on this, these little bumps. And so it really shows us those little bumps, those little changes that are something different than what we would normally want to see. So it's a very accurate way to find very subtle changes in the macula. And it's a very easy test to do. As you see on the bottom here, it's just an instrument. You set your chin and kind of look into it, and it captures an image. Very, very easy to do. Because what we need to do is all these different tests to detect wet macular degeneration at its very earliest. Because usually vision is real good when we have early macular degeneration or even intermediate. But once we develop wet macular degeneration, vision tends to just fall off a cliff. And so it's real important to find it in order to initiate treatment. So, can macular degeneration be cured? Unfortunately, the answer is no, it cannot be cured today. Will I eventually go blind? This is a really important answer. No, but you may need lots of eye care. If you have wet macular degeneration, you'll become quite friendly with your retina specialist because of the treatments you'll be receiving on a fairly frequent ongoing basis. But no, you will not go blind. Can I keep the vision I have now? And the hope is that absolutely yes, with help from your eye doctor, especially if you have appropriate home monitoring, then the idea would be that you do keep the vision that you have now. Really, really important points. So I mentioned diet. What should I be eating? So a Mediterranean type diet or Paleolithic, or really the way I want you to think of it is a healthy diet with more green leafy vegetables like you see in the picture here. Fatty fish we think is good as well, and less refined carbohydrates. You don't see anything white on that plate. You don't see any rice, bread, pasta, sugar. Those are all things that can be really harmful. Now, interestingly, on the right here, we think of when we have a disease or a condition that oftentimes it's about prohibitions, things we cannot do and things that must be taken away. But I want you to realize here that I've got a picture of a glass of red wine and some chocolate. And that these are things that can be good for you in moderation. So it's not all about take away the things that you enjoy, although some of us enjoy things like spinach and kale and salmon. But sometimes some of the things we think of as being indulgent, like red wine and dark chocolate, can be really good for us. And so it's important to remember that. What else can you do? First and foremost, do not smoke. That's probably the most important message I could give you. Get some exercise, eat healthy, don't be obese, protect your eyes and take care of yourself, and let your do best. And then lastly, take a vitamin for macular degeneration. There's different vitamins, and I would encourage you to seek the recommendation of your eye care provider for exactly which vitamin formulation may be right or best for you. So managing dry macular degeneration. Genetic testing is something that can be done to help gauge your risk. If you have a certain level of dry macular degeneration called intermediate, then you should be on an ARIDS. ARIDS stands for Age-Related Eye Disease Study. There's been 2 of these, each with over 4,000 people, that show that at certain stages you can absolutely slow down the progression or prevent the progression from dry to wet macular degeneration. There are many different brands of vitamins that are out there, whether they be vitamins that you buy on a store shelf or that your doctors sell in their office or that your doctors direct you to websites. Whatever it is, I would certainly seek the recommendation of your personal eye care physician. And then home monitoring. Amsler Grid is something some of you may be familiar with, and it's that grid I've shown on a couple slides. It's just a bunch of lines that you look at for distortion. It's a pretty old school test that's really not all that accurate or very sensitive. Way more sensitive is something called the 4C home. And unfortunately, I would tell you not enough people know about the 4C home. Before we talk about the monitoring, there was a question about vitamins. Someone asked zinc or no zinc in ARIDS. And so that's something that there's been some research to this. There's not an absolute definitive scientific stand on this yet, though. There are some that believe that genetics drives your response to vitamins, and some people do poorly with zinc. And then there are others and studies that show that zinc is imperative. So again, I would ask your doctor, if it's something you're interested in, they can do a genetic test to try to gain some insight and guidance as to whether maybe you should or shouldn't be on zinc. The most conclusive data we have to date discusses taking an AREDS2 vitamin with zinc in it. Although, like I said, there's some science to the contrary. So an Amsler grid is what you see here. It's a chart with just a bunch of lines. And the idea is to look with one eye at the little dot in the center and look for any lines that are wavy, distorted, or missing. And an abnormal grid could actually look like this. It still looks normal, right? That's because if you don't do the test perfectly, then it'll still look normal. If you're looking a little off to the side, you have both eyes open, if you're holding it at the wrong distance, there's lots of ways to perform this test abnormally. And that makes even an abnormal macula look normal. This is what it should look like though if it's abnormal. You see that there's some kind of waving, distorted lines. There's an area that's completely missing. That's an abnormal Amsler grid. Again, not an easy test to perform correctly. So I want you to look at this slide and actually let's start that over. So I want you to look at this slide and just kind of look at some of the words in the middle. And I want you to kind of think to yourself, when you start to see anything in it change, and when does it not look normal? Now I'll tell you right now, it's not normal, but many of us, we can kind of, our brains force it to look normal. And unfortunately, a lot of the people that I see with wet macular degeneration don't come in until it looks like this, when they would be much better off if they would have come in to see me or some other eye doctor when there was first just the most subtle of change in the print, not when it looks like this. Once it looks like this, it may very well be too late to have a good outcome. So what's this? This is something that I've been mentioning throughout the talk already a couple of times. It's called a 4C home. And it's a device that I prescribe to my patients that have what's called intermediate dry AMD, which means more than just a little, but not yet wet. They're kind of in that danger zone. And it's something that my patients have in their home. It sits on a desktop or a tabletop or a counter. It's really not that big. It's probably smaller than the size of the laptop computer that I'm using to broadcast to you on. And it's a very elegant way to monitor your vision through a remote clinic for any subtle changes. So let me explain to you what that means. So the 4C Home AMD monitoring program, what happens is it's a device used for home monitoring of dry AMD between your eye doctor appointments. So it's something you have at home. It's been FDA cleared and I've been using it for over 10 years. And Medicare approved it and it's paid for it since 2016. Over 6 million tests have been done and analyzed to date, and I'll explain to you what that means. It's been studied in a large clinical trial in over 1,500 patients. Let me tell you how well it did in that clinical trial. It did so well that before the trial was supposed to stop, they stopped it. And the reason was they couldn't justify not offering this to everybody. It worked so well in the people using it that the people running the study said, we have to stop. We can't ethically not offer this to everybody because it works so well. What happens is you do this test at home, an alert is sent to me or your eye doctor if your eyes change from dry to wet macular degeneration. And this alert gets sent way before you would ever have any visual symptoms. People that use this, well over 90%, that if they convert to wet macular degeneration, it's found when they're still at least 20/40. And the reason that's important is that means about 95% of people when using this retain vision good enough to read and drive, see pictures, do everything that they want to be able to do. And then obviously, if you have an alert while doing this, that provides a really good reason to see your doctor even during a pandemic, because it is so accurate that if this says that there's a problem, it's really important to go see your doctor. So kind of the flow of what happens is I see you as a patient, and then I send a prescription or referral to what's called the No Tunnel Vision Diagnostic Clinic. They then call you, and they look through and they analyze your insurance. They go over all the facts of what you need to know, and then they send a unit to you. They help you get it set up, and it's super, super easy. It's basically plug it in, you're ready to go. And then you start taking this test. It takes a couple minutes per eye. And you need to do it at least a couple times a week. And a lot of my patients do it every day. And when you do it through your home internet, Wi-Fi or whatever it is, the results are transmitted to a remote diagnostic clinic where they watch your results every time it comes in. And it's available to me, your eye doctor, but I don't have to watch it every day because the remote clinic is monitoring your results every day. And if your results show that there's a change for normal, I'm alerted. So then I call you and say, hey, we need to have you come in to check you out. Now, we've had a couple questions come in. Is 4C home any use once you have wet macular degeneration? So when you're actively being treated with wet macular degeneration, I would say no, but oftentimes you only have one eye that's wet and the other eye is still dry, and then it becomes really imperative to watch that eye. So I think that that's real important to know. The second question is, how much does a 4C home cost? Do I need a doctor's approval? So yeah, as far as I know, and when we're at the end, if I'm wrong, I'll have we have Dr. Megan Blemker on the line also, who is an optometrist that works for No Tunnel Vision. And so if I give a wrong answer at the end, I'll have her come on and correct me as far as do I need a doctor's approval, because I believe yes, you do need a doctor's prescription because there's a few facts about your eyes that need to be verified because of the FDA approval. So the stage of your macular degeneration and your vision. And how much does a 4C home cost? So the actual device doesn't cost anything. There is a monthly monitoring fee that is something that's covered by Medicare. Over 60% of patients that have Medicare, especially if you have secondary insurance, don't pay anything. So the majority of my patients, I always ask them, how much does it cost you? And most of them tell me, I don't pay anything for it. If all you have is Medicare and it's covering 80%, then you're likely to pay about $14 a month. And so I think that most of us would agree that $14 is a very reasonable cost to have such a close monitoring of your vision. But again, for most of my patients, they don't pay a penny, which is amazing to me. So what happens is the test, you see this little line in the instrument, and what you do is use a mouse to click on this little distortion. And so the instrument's following, are you clicking on and following the correct distortion, or is your eye creating one in an area where it's not? Again, it takes about 3 minutes an eye. You're just looking into this instrument. It's very, very easy to do. This is what the report looks like if I want to go in and look at the test you've been doing over time. And we see here, this line, a couple spikes, but here we go above this line here that has been deemed to be abnormal. As soon as my patient goes above that line, they stray from normal, then I get an alert. I have my patient come in, I check him in the clinic and make sure that everything is either okay or not. Again, really, really important to realize that the vast, vast majority of people, if you're using 4C home, identify wet macular degeneration when vision is still really, really good, far better than with an Amsler Grid, far better than what any other study shows when people get treated. So something really, really important to think about if you have macular degeneration, especially during a pandemic, especially if you're worried about office visits, really important to maintain this monitoring of your vision. So what can some of the symptoms be if you're not using a 4C home? So you may have a decrease in vision, like 20/30, 20/50 on an eye chart. You may also notice that when you look at things, that the center of them becomes kind of blurred or distorted. Again, not everybody experiences that because many people have very minimal, if any, symptoms at all. Straight lines may, instead of being straight, may be kind of wavy. You may develop a blind spot in the center of your vision. But again, many people have no symptoms at all. And so don't think that if my vision's good, that my eyes are healthy. Or if my vision's good, my macular degeneration isn't wet, because you can have really good vision and still have wet macular degeneration. So really important to realize that vision is not always the best indicator of exactly what's going on. Here we see kind of another depiction of what wet macular degeneration looks like. These are abnormal blood vessels that start growing, and then they break through this layer here, this little window, and they start to bleed. That's what we hope you do not develop. Wet AMD, again, it's abnormal blood vessels that bleed, and here we can see a depiction of bleeding inside the eye. So over here we have normal, over here we have bleeding, so you can see that kind of red splotchy area. That's a fairly extreme case. Oftentimes it's much, much more subtle, and it's sometimes not that easy to pick up. But this is one that would be pretty easy to be able to see. Another test that you may experience in the doctor's office, and I'm just going over this so that you're aware of some of the things that may happen or some of the things you may have heard about, is something called fluoroscein angiography. So basically what this is we see in the picture, someone is injecting some dye into a vein in your arm. And then what happens, that vein goes through the dye goes through your body, goes up to your eye, and goes through all the little blood vessels in your eye and is able to show us if there's any leaking, if there's any bleeding. So this right here is an OCT image I showed you previously. That's that ultrasound, doesn't require any dye. And these are of the fluoroscein angiography, that once dye has been injected, do we see areas that leak, that become really bright, or that are really dark because the dye is blocked by blood. So it's another test that is occasionally administered. It's pretty easy to go through. Most people, it's no big deal. The test takes about 5 minutes, but the injection of the dye takes 15 or 20 seconds. So most of these things are pretty easy to go through as a patient. So now I want to share with you what happens if you do develop wet macular degeneration and it needs to be treated. The standard of care, the main treatment, is something called anti-VEGF medication. It's a drug that's actually injected into your eye, which I know sounds terrible, but we'll hear from Larry, who's had this done. And I think what he'll tell you is it's not terrible. Most people would tell you that minimal pain, if any, really barely any discomfort, but it's worth it because that's the best way we know to potentially improve your vision. It's very low risk. And as it turns out, there's now 4 different medications available. So I got 2 videos going here.
Hey, this is
the one on the top is someone that's going to get, it's probably the quickest intravitreal injection I've seen of this medication. Someone just holds their eye open, boom, done. That's pretty quick. The one on the bottom here, let's see if I can get that to play. So my video is not playing right now, but that was just going to be another version. It's going to take a little longer, a little more typical, where they put some solution in the eye to clean it. And really the whole thing, I don't know, a minute, maybe 2. It's really pretty quick. And so one of the, Carol just sent in a comment. I get a monthly injection and have been for about 14 months. My vision has improved from when I was first diagnosed. Luckily I caught it quickly. And I think that's the key to not losing more vision. The injection's not terrible. And so Carol, thank you for that comment. And that's a pretty universal comment that I hear from my patients. I always ask my patients after I send them to get injections, how to go. And almost always they say, you know what? The worst part was when you told me about it and not the actual injection. So really not a bad thing to go through at all. So again, just depicting a needle going into the eye, injecting the medication that gives it direct access to those abnormal growing blood vessels. So as far as getting injections, there's really 3 main treatment regimens. One is PRN, you may have heard that term, or kind of treat and observe. That's where generally people would get an injection once a month for 3 months, and then kind of as needed thereafter. And for most people, over the course of the first year, that's going to be almost every month. And then it slows down a little bit after that, but remains pretty regular. The second one is called treat and extend, where people get an injection once a month for 3 months, and then gradually extend the time between injections. And the newest approved medication is many people can go 12 to 16 weeks in between injections. And there is actually something brand new that's not FDA approved yet, that is a little port that gets put in the eye and filled and slowly releases medication over the course of 6 months, that well over 95% of people are able to go 6 months between treatments. So that's incredible to really decrease the number of treatments that you need and still have great results. And then the third regimen today is monthly injections. And there are many people that do receive injections once a month, every month, very, very routinely. Now, most people do really well. The most important thing is what's your vision when you first start treatment. And if you start with good vision, many people can remain seeing fantastic. But what I want you to realize is not everybody does well. Some people have a poor medical outcome, especially if you're not caught early enough with 4C home. Now, this does not mean your journey is over, especially for an optometry office. A focus on vision and optimizing your vision has to be made. So let me tell you what that means. So there's something called low vision. That's when people have vision that's not good enough to do what you want with traditional glasses or contacts or surgery. And so when you have low vision or some decrease or abnormal vision, it's important to realize that good lighting is important. Reduce the amount of glare you have, either through lighting or glasses. Reduce glare. Increase your contrast. So black on white is better than shades of gray. Using low vision devices such as magnifiers, taking advantage of large print books, audio books, or electronic devices such as video magnifiers. Now, as it turns out, almost everybody has an incredible high-tech magnifier in their hand every day. If you have a smartphone. If you have a smartphone, you can use it as an incredible magnifier. So realize that without even anything else, you have incredible technology already in your hands. But there's lots of other things that specialists, low vision specialists can prescribe, whether it's telescopes that fit in your glasses or really high-tech implants and magnifiers that are used in Australia and a little bit in the United States. This is something that I've used with a couple of my patients, that it's something that just sits on the side of a pair of regular glasses. It's a camera that captures images of any print, and then it reads it to you. So it uses something called optical character recognition and reads to you. It can recognize faces once you program it to who people are. It can read boxes. It can read labels. It can read price tags. It can read money. Incredible things like this out there. So even if someone's told you there's nothing else we can do, your vision is, and injections won't help anymore, even if that's the case, there are plenty of things that you can do to maximize, optimize and maximize your ability to function and function relatively normally. I want to conclude with making sure you understand that macular degeneration is very common. It starts out as dry, but can progress to the wet type. Early diagnosis and treatment are critical for good outcomes. Healthy living reduces your risk, and you're not alone. You should seek resources like great eye care prescribers, providers, whether it's prescribing the right low vision devices, having routine care, getting injections, whatever it is. Organizations like Macular Degeneration Association, there's lots of things out there for you. One thing that I want to point out, so hopefully many of you will go to our website, macularhope.org. So that's the Macular Degeneration Association website. And one of the things that's on there, and one of the things that I've helped to kind of spearhead, is we have a section where you can go and look for a macular degeneration center of excellence. And there are both retina specialists and optometrists that have been designated as centers of excellence. And that's somewhere where you can go where if you say, you know what, I'm worried about macular degeneration, or I know someone that's worried, or I need a new doctor that knows about and takes care of macular degeneration. This is a listing of doctors that have met specific criteria that we've laid out that are able to help take care of you. And so if you're wondering, does my doctor take care of this? Do they have the right tools? Either A, you should encourage them, if they do, to join our centers of excellence so that they can help others. Or if you're looking for a provider, that's a great place to look. So at the macularhope.org, centers of excellence, and find a provider there, whether it's for you or the best thing you could do for somebody else today that's wondering what can they do. Help them find a provider in their local area that's one of our centers of excellence. So with that, I want to thank everyone for logging in. Please do not log out yet for a couple of reasons. One, we have a drawing for the gift card. Two, I want to hear just for a brief moment from Larry about his experience. Larry, who you heard from at the very beginning, who is the chair of the Macular Degeneration Association, is also a macular degeneration patient. And so I think hearing from him as a patient is it's so valuable, because for me to come to you as a doctor that knows the science and what to do, that's one thing. But to hear something from a peer of yours, I think is even more important. So Larry, I want to hand it over to you. Then While Larry's talking, feel free to send in questions. And when Larry's done, I'll be happy to answer any of the questions that you send in.
All right. Well, welcome everybody. I'm Larry Hoffhammer again, and I hope you enjoyed this presentation. I've heard macular presentations for nearly a decade now, and this is probably one of the finest I've ever heard. There was so much information, but I want to give you some information on what I've been through and why I decided I wanted to create an organization to help people like myself. What really happened was my mother had wet macular degeneration. There was no treatment for it at the time. That was 20 years ago, and she lost her entire central vision. She couldn't see her kids, she couldn't see me, couldn't read, couldn't watch television anymore. So when I decided I wanted to do something, because it was so frustrating for her to carry on her daily living, including cooking, reading, watching television, I just felt very badly that information should be made available. So ergo, the Macular Degeneration Association. Well, about a year and a half ago, I could attest to the genetic component because I ended up with wet macular degeneration. I learned two things. One, the genetic connection, and two, the fact that I caught it almost immediately. I happened to have already had a retina specialist that was treating me because I had diabetes. But I saw the retina specialist the next day and got a shot. The good news is I have 20/20 vision. The bad news is I have one good eye and one with intermediate dry. So I wanted to protect the dry. The wet one is perfect now. I still get regular shots. I'm up to, I think, 3 months. But the retina doctor is continuing to look at the new technology and the new treatments, et cetera. So, but at the same time, I learned that my sister, who's 7 years younger than me, also has wet macular degeneration in both eyes. So there is a genetic component to it, but the moral of the story is catch it early. Now, as far as catching it early, I am a strong believer and user of the 4C Home monitoring device. I use it almost every day, and it protects the one eye that's dry. You don't do it for the wet eye. And so far, so good. And I think it's probably one of the most important pieces of technology today to preserve vision for the millions of people who are suffering from age-related macular degeneration. So again, I want to thank our sponsors. I want to thank Dr. Gerson for a great presentation. And I hope you all have learned a lot, and please visit our website for more information on a regular basis. So thank you, and God bless you all. Stay healthy.
So Larry, we've gotten a couple questions I want to answer. The first one is how do you use a smartphone as a magnifier? And to some extent that depends on the smartphone that you have. Really the easiest, simplest way is just turning on the camera and then just using your fingers to blow up the picture of what you're looking at with your camera. So if you're trying to read something, you can turn on your camera, you can turn on even your flash with a light to illuminate it if you're somewhere where there's poor illumination. And so that's probably the easiest way that you can with any smartphone. There's also settings in your smartphone, again, regardless of whether it's an Android or an Apple, in order to magnify things like your text messages or your emails. There's also ways to change the colors of them. So some people prefer, usually things are set as a default to be black print or dark print on a white background. But some people, especially people with some visual issues, prefer to have a black background with white print. That's a little bit better. And again, you can use that setting in your smartphone. And then there's different apps. So what I would encourage you to do is just go to either the Google Play or the Apple App Store and just look up magnifiers. And there's a bunch on there. The other thing that you'll find is there are apps that use what's called optical character recognition, where it basically takes a picture of something and then it reads it to you. So there's multiple ways to use your phone, whether to magnify or to take pictures and have it make it to where it reads to you what it is. So that's the other way to be able to do it. Another question from Judith is, how accurate is genetic testing? And so I guess there's really two ways to answer that. The first way is it's incredibly accurate at looking at certain spots on certain genes. Okay, so it's incredible testing that 15 years ago would have seemed like space age technology. The question isn't how accurate is the testing. The real question is, how accurate is the interpretation of the results? And that's something that there's quite a bit of discussion about within the eye care community on what those results really mean. I will tell you that there are some that feel that genetics is absolutely everything as far as who will get it and to what stage it will progress and what vitamins to use about it. The other faction says, yeah, we agree that genetics can tell us who's likely to get macular degeneration or who's likely to develop wet macular degeneration, but disagree on the vitamin part of it. So the testing is accurate, it's just how is it interpreted? From Margaret, what's the status of genetic studies for identifying and modifying the gene that is causing macular degeneration? It's a great question. We don't yet know how to do that. So we've identified, we think, the main genes that are causative of macular degeneration. We do not yet know how to alter those genes. There are some different eye diseases where studies are being done where things are being injected into the eye to try to alter the DNA of the cells in the eye to cause them to reprogram and to rebuild normally. But as far as macular degeneration, we don't know yet how we can change those genes and reverse macular degeneration. So we're not there yet on that. All right. So we'll give another minute for any other questions. So, something else that I got a question about is I'll tell you, about the 4C home. Again, what I hear from my patients is very, very easy to use. And I used to ask patients if they can use a mouse, a computer mouse. And I still kind of do, because that's really the only thing you need to be able to do. You don't need to know how to use a computer. If you can use a mouse, or if you can look at the mouse that I have in my office and realize that it's something you use with a computer and not something that scurries along the floor, then it's something that you will be able to use really easily. So even though it's incredible high technology, it's just amazing in how it monitors things. It's very, very, I would say, low technology as far as what you need to be able to use it. You don't need to be technologically very gifted or smart to be able to use it. It's pretty easy. A question that just came in from one of our viewers: how frequently are patients who have 4C home devices required to test on the device, and will somebody help teach me how to use it? Great question. So the way it's approved by the FDA, you have to use it at least twice in order for it to be something that's covered by insurance, at least twice a week, rather. And so what's really cool about it is, number one, it's portable. You can take it with you if you go on vacation. But if you don't, and you don't use it for a week or two, you'll get a call saying, hey, we noticed you haven't been testing. Is there a reason you haven't been testing? So it's kind of like having a whole other doctor's office that's helping take care of you. Will somebody help teach me how to use the device? Yeah, they do. Someone will absolutely walk you through it, make it very, very easy to be able to use. I probably have somewhere between 20 and 25 patients that are currently using 4C home. And I don't know that I've ever had somebody that has tried to use it that was not able to, that through the instruction, and it's always, the instruction has always been virtual. And so this is something that was, 12 years ago when it first came out, or 11 years ago. It was set up for times like this because it doesn't require anybody to come out to your house. It doesn't require you to physically interact with anybody. It's all done over the phone. So it always has been and it remains something that's super, super easy to do. Real easy to do. So that's a really good question, because I know a lot of people, and I'm the same way, right? A lot of people, me included, can be kind of fearful of technology and worried that, well, it sounds great, but I'm not going to be able to do it. But this is something that's super, super easy to be able to use.
On the genetic testing, they have a test called Macular Risk, which
Yep.
which I took about, I don't know, 5-6 years ago before I ever had macular degeneration. And my risk was 84%. So it shouldn't have been a surprise. So they are working on trying to get FDA approval for the test, but I recommend the macular risk if you're really concerned.
Yeah, I think that's a great point. And, I've done the macular risk test on a couple hundred of my patients. And the way I explain to people is that this is a way that at the very least we can tell what your risk is. And the higher risk you are, then the more seriously we need to take this. And, if you're at higher risk, then, okay, you're someone that we'll see in the office a little more often. So you may be seeing your doctor, even with dry macular degeneration, 2 or 3 or 4 times a year because you have higher risk. So I think that's a really good point, and almost all my patients, when presented the opportunity, say they want to know. I've only ever had 2 patients that have said, I don't want to know. So I think most people want to know. Where can I get information on the genetic studies and if I want to be a part of a clinical trial? So there's a couple ways to do that. One is to ask your eye doctor if they know about studies in your local area. Usually they're in big cities and oftentimes at large retina specific practices. You can go to clinicaltrials.gov and you can just type in macular degeneration genetics, and that will show you all the ongoing trials currently on macular degeneration and genetics, and you can click on it to find out where there are sites enrolling. I have wet AMD in one eye, but the other eye is healthy. Would the 4C home be useful in the healthy eye? So what I would say to that is it kind of depends on what healthy means. If healthy means, completely healthy, no macular degeneration, then you wouldn't qualify for using the 4C home. If healthy means it's just not wet, if you have intermediate dry macular degeneration, then absolutely, it's really important for you to be using 4C home. And that's something that your doctor should be able to tell you if you would qualify or not. What if the doctor asks if you want to join a clinical trial? It's a really good question, because the only way we learn about any of these things is through clinical trials. And if you're in a clinical trial, so historically, oftentimes in clinical trials, there was what's called a placebo, meaning some of the people got nothing, and then other people got what was being tested. And clinical trials today are testing established known drugs compared to the new ones. So nobody gets nothing. And most of the drugs, if you're being offered, if it's what's called a phase 3 clinical trial, we already have a pretty good idea that A, they don't harm people, that what's being tried doesn't cause harm and is likely to help. So I would definitely encourage you to consider being in clinical trials, because that's the only way we find out about new things. How much?
I have an announcement. I don't know if anybody else has heard it, but Robert O'Connell has won the raffle.
Yep. So Robert O'Connell, you were the randomly drawn raffle winner. How much error is there with the 4C home? So the best way that I can explain it to you is if you're doing it at least or more than 2 times a week, the likelihood of having a false positive is about once every 4 years. So that's a really, really low false positive rate. So very, very little error in it. When will stem cell treatments be available for treatment of dry AMD? So let me give you the most, and that was asked by our raffle winner, Robert O'Connell. So stem cell treatments. The most important thing I can tell you about stem cell treatments is there are no approved stem cell treatments for AMD today. And that is really, Larry, that's really important, particularly in your neck of the woods in Florida. There were a number of people, it was about 2 years ago now, that went to a place that claimed to have a stem cell treatment for macular degeneration. They got injections, they went blind. So there is no approved stem cell treatment today for macular degeneration. When will there be stem cell treatments? Boy, I wish I knew. There's nothing that's far enough along in clinical trials that I could tell you with any confidence that there'll be something in the next year or 2 or even 5. So maybe once we have a coronavirus vaccine, then Operation Warp Speed will go into effect for stem cell treatments for AMD. That'd be great. And then maybe we could come up with something faster. But if you're asking me to guess, I would say that it won't be within the next 5 years, unless it's part of a clinical trial. And I guess to go back to that one real quick, if you're going to be part of a clinical trial, clinicaltrials.gov. So clinicaltrials.gov is a government website. That's one way that you can know that the clinical trial that you're enrolling in is legitimate. Other than, because anybody can just say, hey, I'm doing a clinical trial. And that's not real. Those are the people that get in trouble. All right, so we'll wait about 30 seconds if there's any other questions. Larry, do you have any other comments or remarks?
Please visit the website and let us know on the website your opinion of this presentation. That would be very helpful information.
Yeah, we'd love to know, because our goal is to continue with patient education. Larry, you guys have done a great job for years in doing these live and in person. And so, this is our first attempt at kind of a new version of doing this. And whether it's to reach people that don't live in the metropolitan areas where you do the live in-person presentations, or whether it's the way we have to do it now, hopefully people are finding this useful. So if you did, like Larry said, if you know someone that may benefit or would enjoy this, we're doing it again this afternoon, and we'd love to have them sign up for this afternoon. All right. So with that, I guess we'll conclude, Larry.
Yep. Wear your mask. Keep your distance.
That's right. Stay healthy. Thank you again. And don't forget to go to macularhope.org and check out the Centers of Excellence part of the website for either yourself or to help others find a provider.